Hello, my name is Dr. Alan Sosa. I am a radiation oncologist, and I've been with Community Physician Network since 2023. It's going to be a very cliche answer, but I knew I wanted to be a doctor since I was pretty young. I had a very close relationship with my pediatrician growing up when I was about 4 years old. I remember I would be very excited to go to the doctor, which is very unusual, and I'd go and give him a big hug. And ever since then, he would let me play with his stethoscope. And I think ever since, I think that just really planted sort of a little seed that I had wanted to become a doctor. Radiation oncology, it's a very high-tech field, in my opinion. I think it's arguably one of the higher tech fields in medicine, and it allows us to really use what we know clinically about tumor biology, about imaging, and about anatomy, and it really allows us to use that information to help the patient the best that we can. I want to make sure that I'm taking care of the patient as a whole. I really want to go beyond the surface level questions and really just really get to know my patients on a fundamental level. I want to know what their interests are, what their family life is like, because ultimately we know the details of the cancer therapy, and that's going to help us make the best decisions when it comes to treating the tumor, the cancer. But I think by knowing the patient more, it helps me tailor the therapy to them as an individual. As a radiation oncologist, we're directly patient-facing, and that means that we're able to spend a good amount of time with our patients, whether in consultation, getting them to know what the treatment options are going to be, getting to spend time with them throughout treatments, which can be as short as a week or even many weeks as well. That helps us establish a very long-term relationship with our patients through treatment and beyond. And I think that's what really motivates me to keep going and give my best each day, right? Because these, at the end of the, I feel like at the end of treatment, they're almost like family because you've been seeing them for so long, right? So it's very important to make sure that you're giving it your best every single day. I am a big fan of cinema. I really enjoy music, whether that be either at home or going to concerts. I like to do traveling, although I will admit that I haven't done a whole lot of traveling in the past, and I'm trying to catch up, really. I think it's a lot of the simple things that everybody else likes, which is spending time with friends and family, and just going for a nighttime drive or a scenic drive, just small things like that. My name is Dr. Alan Sosa. I am a radiation oncologist, and I've been with Community Physician Network since 2023.